Good evening once again. Recreational use of marijuana is coming to the state of New York sooner or later, maybe as soon as this year. But what about medical use for marijuana? Well, it's already legal here, and medical marijuana is being used now to treat a number of different ailments, chronic migraines, seizures, and a variety of pain-related issues. But there is one use that is now causing some concern, at least for some people, using marijuana to treat opioid addiction. 7 Eyewitness News reporter Sean Robson on the story for us tonight.
I don't feel like we're improving our situation as a community.
Horizon Health Services CEO Ann Constantino took to Twitter this weekend to make a case against medical marijuana as a treatment for opioid addiction.
There's a good and compelling case to be made for the fact that it makes things much more difficult.
Just a few months ago, state lawmakers approved opioid addiction as a reason to be prescribed medical marijuana. Still, Constantino argues that the treatment can have adverse effects on addiction.
They're mood altering, they're mind altering. You have effects of work and raising families and community health. So I think we do need to be concerned about that.
But not everyone in the medical community shares that belief. Dr. Laszlo Mechler is the director of the cannabis clinic at Dent Neurologic Institute in Amherst. He treats around 3,500 opioid users with medical cannabis.
It's not a simple, well, marijuana is the panacea and cures everything. It doesn't. We just know that patients on medical marijuana smoke less, drink less, and use illicit drugs less.
Mechler says 20,000 people die each year from prescription opioids, and of the users he treats, 81% have come off opioids or decreased their dosage.
The bottom line is, in today's world, you need every tool you can have to treat this very ill population who has the potential to overdose on a day-to-day basis.
And while Mechler and Constantino don't see eye to eye on the use, they both agree more research needs to be done.
So I'm not looking at people who want to get high. I'm looking at people who want to get better.
I just want to ask our legislators to be cautious and careful and remember the health of the community.
And if you think medical marijuana gives you a buzz, Mechler told me of the 7,000 patients he treats for either opioid use or chronic pain, only 2% actually feel high. Sean Robson, 7 Eyewitness News.